So this is very important. This is very important. So, whenever we are focusing on the prevention, so keep in your mind, it's not about just to eat healthy or just talk about the other factors. So, focus on your emotional regulation, and this can help you to like reduce the chances of having such chronic diseases. So emotional regulation is very important. So whatever you are thinking, whatever you are feeling, always keep the optimistic approach. And if there is any stressor, it's better rather than struggling at on and alone, you can speak to the professional and get professional help to manage this. So thank you so much for giving me an opportunity to talk about the link between stress and how it can we can use it to prevent the cancer, the chronic diseases. So thank you so much. And if there will be any questions, so you people can ask.
Thank you so much, Miss Amina. Before we proceed further, if anyone had a question, they may ask from Dr. Ataur Rahman and Miss Amina Iftikhar as well. And I want to make an announcement. If you want to get updates for Cancer Awareness Gap, so there's a link in the chat box. You may can join the link. Participant, if you have any question answers from Miss Amina Iftikhar and Dr. Ataur Rahman, you may ask. Well, till now we have our third speaker is here, so now it's a time to introduce our third speaker. Our third speaker is Miss Nada. She's a therapeutic nutritionist with a master degree in nutrition and diploma in therapeutic nutrition. She will help us to understand the metabolic and nutritional science behind the fasting and its prevention implications. Over to you, Miss Nada.
Hello everyone. I'm Nada Abiman, clinical nutritionist in Egypt. Um, I had take a diploma in therapeutic nutrition and master degree in therapeutic nutrition. And now I work in clinic as a clinical nutritionist. Um, now we will talk about fasting and effect to reduce the risk of cancer. The first thing, kinds of fasting: periodic diet calorie restriction, dietary restriction, dietary manipulation, intermediating or short-term fasting, and the last one, prolonged fasting. Intermediating fasting or prolonged fasting is fasting in Ramadan. In Egypt, we fasting about uh, 10 hours. Fasting reduce of risk of cancer. Starvation induced change in الجينوم organization, chromatin remodeling, and metabolic pathway modeling. الفاستنج reduce الريسك of cancer. For example, glucose in insulin growth factor and other related enzymes and protein may increase the effectiveness of chemotherapy. Fasting has anti-warburg effect and could have a positive impact on the drug pharmacokinetics and contribute to reduce its side effect and improve the chemotherapeutic index, and finally overcome at least the particular issue of drug resistance. So fasting is important to treat cancer. Fasting reduce the risk of cancer. Fasting has beneficial impact on renewal of stem cell and on the immune system, in particular on a natural killer cell, as well as on the oxidant system that enable cancer growth control. Fasting on الكانسر, fasting seems to cyanese tumor cell and increase the effect of الاوتكم of radiation therapy. So fasting is important on prevention and treat الكانسر. Now I finished my part. Anyone have question?
Thank you so much, Miss Nada, for your amazing knowledge. So, first of all, I would like to thank all of the speaker for sharing such an insightful knowledge with us. We are truly privileged to learn such an amazing thing from our professional. Now, participant, we are moving forward to Q&A session. If anyone had a question from their speakers, they may ask from speakers, and please put your question in chat box.
I will answer some question for me in chatbot. Can الفاستنج be safely recommended for all cancer patient? Why or why not? Fasting is highly recommended for all patient with cancer because or reasons uh, I talk about it.
Is there any another question remaining? You may ask from the speakers. Participants, if you are clear with the question answers, you may please thumb up to then we can understand that you are clear with this. So I guess all participants are clear with this.
Rubab, I just want to add something. One
Yes, yeah.
about there was a question uh, about the cancer patient should they fast or not. Patients with malnutrition and with weight loss, I don't recommend them to fast. They need high calorie, high protein diets, and during that, a negative nitrogen balance phase, I think it can bounce or it can backfire. So, and in Islam, in our religion, it's not recommended for all sick people. They are given this exception, and I think patients who needs high calorie and high protein diet, hypercatabolic patients, they should fast with caution and under the supervision of oncologist and dietitian, oncology dietitian.
Okay, thank you, sir. So we had another question. She's asking, people with cancer already suffer from fertility issue. How can we go recommend them fasting if they are already malnourished?
Yeah, that's I already gave this answer.
Okay, thank you so much, sir.
I
So I
don't
guess
recommend.
okay. I guess participants are clear with the question answers. So now it's a time for an announcement. Okay, there's another question. For cancer patient, it is mandatory to be fast in the month of Ramadan.
The sick people, they have exception. If they don't want to fast, it's okay. But the one with no weight loss, with the patient with remission, with the positive outcome of cancer therapy, and with a stable weight, they can go with the fast. But as I said before, no need to fast if patient is malnourished or losing weight, and it's not mandatory for them.
I think
Okay.
doctor uh, patient with a comorbid condition fasting is not allowed.
Yeah.
Okay, thank you so much, both of my speakers. Now it's a time for an announcement. So the announcement is that CAP is officially partnering with Pakistan Food Bank to initiate a fundraising then supportive dedicated to providing nutritional support for cancer patients and undergoing treatment, supporting feeding programs for unprivileged patients, contributing to cancer education, the awareness for affected families. This partnership moves us from discussion to action. Together alongside PASO, PDNA Science International, and Pakistan Food Bank, We aim not only to raise awareness but to deliver the real impact. If today's session inspired you, we invite you to stay connected with us and collaborate and continue this meaningful mission. Because prevention is a powerful and together we are stronger. Everyone have a good evening and Allah Hafiz.